The HMPV virus has raised alarm almost across the country. 2 cases have been detected in Bengaluru and 1 in Ahmedabad in Gujarat. There's also now 1 more case that's being reported, and this case is being reported from Bengal. The HMPV virus causes symptoms that are very similar to common cold. The centre says they're fully prepared for this virus, they're aware of this virus, and there is no reason to be concerned. At least as of now, all the information that's available in public domain, there is no reason to worry. India Today's Sneha Mordani gets us more on the HMPV virus.
The HMPV virus has now been reported in India. The virus that makes infants ill and can cause a serious outcome in immunocompromised individuals is causing alarm in the country. Over 4 cases have been seen in India. The government of India says that the virus is in circulation in India for years now, like in many parts of the world, and that there is no reason to worry.
The Health Ministry, the Indian Council for Medical Research, and the National Centre for Disease Control are keeping a close watch on the situation in China as well as in the neighboring countries. The health systems and surveillance networks of the country remain vigilant, ensuring the country is ready to respond promptly to any emerging health challenges.
Metapneumovirus is like any other respiratory virus which causes a common cold. And in the very old and the very young, it could cause flu-like symptoms. The general precautions that we use against all respiratory infections, which means in case somebody has cough and cold, he should avoid coming in contact with a lot number of people so that the infection does not spread.
Last week, social media was flooded with pictures from China that showed overwhelmed hospitals and crematoriums. The World Health Organization has not said anything just yet on the extent of the crisis in China. India says they have sought more information. The government of India says that in the infections of HMPV seen in India right now, the patients had no travel history, no international travel history, indicating that the increase in cases seen in India right now has got no link to the outbreak in China. But we do not know just yet. The government says we are monitoring the situation very closely. Clearly, vigilance is at its peak given our experience 5 years ago. ILI, which is influenza-like illness, and SARI, which is severe acute respiratory infections, are being very closely monitored, says the Union Health Ministry. Perhaps patterns of an increase in influenza-like illnesses will give better indications about where we stand today. But right now, an increase in respiratory infections has not been seen, says the government of India. The virus leads to symptoms similar to the flu, such as cough, fever, runny nose and sore throat. It may sometimes lead to more severe symptoms like pneumonia, a lung infection that causes air sacs to be filled with fluids. A severe infection is more likely in children under the age of 5 when they get the infection for the first time. It may also cause severe symptoms in the elderly and those who have a weakened immune system.
In the infants, they have not been exposed to the viruses, so they do not have the antibodies and enough, and apart from that, their immune system is also not fully developed. As a result, they are not able to fight out this virus.
What then are the precautions to be taken?
There could be some strain variation which could be there in the new strain, which is causing the outbreak in the area which is affected by currently circulating HMPV virus. But if I see of that condition in India, I can say right now we are not suffering any panic situation related to HMPV virus, but yes, preparedness is always required.
China says this is a winter occurrence. Hong Kong and Malaysia too have now reported cases of the human metapneumovirus. In New Delhi, Sneha Mordani for India Today TV.